Hi guys, welcome back to the channel. Happy Chhat Puja. As you all know, it's a 4 to 5 day festival celebrated in Bihar. Oh, wishing you all a happy Chhat Puja. So last class we have finished with benign migratory glossitis. Today we'll be starting with Plummer Vinson syndrome. Okay, let's start. Plummer Vinson syndrome, it is also known as Patterson-Kelly syndrome. It is more common in white people, in women with postmenopausal thing, and with atrophic glossitis. So as the oral and maxillofacial surgeon, we should be paying attention to atrophic glossitis. If atrophic glossitis is present, we should look for these two also. Okay, now tongue pain may be present, but many are painless. Mainly painless tongue is there. Always recognize iron deficiency anemia. So atrophic glossitis and iron deficiency anemia are two most important thing for the diagnosis of Plummer Vinson syndrome or Patterson-Kelly syndrome. Additionally, there can be angular cheilitis, dysphagia, and esophageal webs. Okay, dysphagia can be written as PHAGIA or PHASIA. Anyway, okay, so three more things are additionally there. The first is angular cheilitis, second is dysphagia, and third is esophageal webs. Okay, dysphagia is pain during swallowing. Okay. Now, in some cases, concave fingernail or toenail is associated with Plummer Vinson syndrome. Now, differential diagnosis can be atrophic glossitis, obviously, without pain or painless or association with candidiasis. Then lichen planus, and third is lichenoid drug reaction. So these are the differential diagnosis for Plummer Vinson syndrome. Now coming to diagnostic workup, complete blood count, total iron binding capacity, that is TIBC, and serum iron. So complete blood count will show that there is reduced hemoglobin, and we'll see different values like MCV, MHCV, and the two most important thing is total iron binding capacity, TIBC, and serum iron. Okay, so TIBC will be elevated in Plummer Vinson syndrome and serum iron will be low, inducive of deficiency, iron deficiency anemia also, and it is common in Plummer Vinson syndrome also. As I have discussed earlier, that iron deficiency anemia plus atrophic glossitis is the confirmation of, or is a point towards the Plummer Vinson syndrome. Now, endoscopic assessment of pharynx and esophagus, obviously we should go for, because esophageal webs and dysphagia is additionally there. Any oral lesion or pharyngoesophageal lesion with ulceration should receive a biopsy. Okay. Now histopathology as such कुछ है नहीं. Just when we do biopsy of tongue, which is very unspecific or non-specific, it will show atrophy of filiform and fungiform papilla, and there will be mild epithelial dysplasia present. Okay. Now, coming to the treatment plan and prognosis, topical agents such as magic mouthwash, viscous xylocaine, and oral steroid solution offer little symptomatic relief. So, topical agents can be given for the symptomatic relief. The tongue will improve with supplemental iron and 1000 units of vitamin C. So, supplements we will give like iron and vitamin C. Now, diagnosed patients should be monitored for increasing dysphagia and development of esophageal webs. So, these two are the concerned thing. So, we should look for this. And now, for this, we should go for periodic CT scan, PET scan, or esophageal endoscopy. When esophageal webs and dysphagia is concerned and increasing, then we'll go for these diagnosis tools. Now, esophageal webs may be lysed or esophagus may be dilated, phagus may be dilated to improve the dysphagia. So that's all about treatment and prognosis, and that's all about Plummer Vinson syndrome. We'll be starting next topic in the next class. Till then, like, share, subscribe, and comment.